Hey everyone, and welcome to the channel. Summer is finally here, bringing sunshine, vacations, and mosquitoes. These tiny pests might seem harmless, but they can carry some serious illnesses. Today, we're diving deep into the causes, symptoms, and most importantly, the precautions you can take to stay safe. Let's get started. As the summer heat intensifies, so does the risk of mosquito-borne diseases such as dengue, malaria, and chikungunya. Increased breeding sites for mosquitoes, coupled with inadequate vector control measures and personal protection, have led to a surge in these diseases incidents. Standing water in containers like coolers, pots, and tires should be eliminated, or insecticides should be applied to prevent breeding. Mosquitoes are not just annoying. They can also be carriers of various viruses and parasites. When a mosquito bites an infected person or animal, it can pick up the virus or parasite. Then, when it bites another person, it can transmit the disease. It's like a tiny, airborne delivery system for sickness. Malaria. Malaria, a potentially life-threatening illness caused by a parasite transmitted by the female Anopheles mosquito. This parasite attacks the liver and red blood cells, leading to a range of symptoms. Symptoms: fever, high and chills, headache, muscle aches, nausea, and vomiting, fatigue in severe cases, seizures, coma, and death. Precautions: use an EPA-registered insect repellent containing DEET, picaridin, oil of lemon eucalyptus, OLE, or IR3535. Apply according to product instructions. Wear long-sleeved shirts, pants, and socks, especially during peak mosquito hours, dusk and dawn. If traveling to areas with high malaria risk, use insecticide-treated bed nets while sleeping. Eliminate standing water around your home where mosquitoes can lay eggs. Dengue. Dengue fever, a mosquito-borne viral infection found in tropical and subtropical regions. Dengue has 5 different strains, and a previous infection with one doesn't guarantee immunity to others. In fact, subsequent infections can be more severe. Symptoms: sudden high fever, severe headache, muscle, joint, and bone pain, often described as breakbone fever, nausea and vomiting, rash in severe cases, internal bleeding and shock, dengue hemorrhagic fever. Precautions: similar to malaria, prevention relies on avoiding mosquito bites. Repellents, protective clothing, and eliminating standing water are crucial. There's no vaccine for dengue fever, but early diagnosis and treatment can significantly improve outcomes. Zika virus. Zika virus, transmitted by Aedes mosquitoes, is particularly dangerous for pregnant women and women who are trying to conceive. Infection during pregnancy can cause serious birth defects, including microcephaly, a condition where a baby's head is smaller than expected. It can also lead to other developmental problems. Symptoms: fever, rash, joint pain, conjunctivitis, pink eye, headache, muscle aches. Precautions: if you're pregnant or planning to become pregnant, take extra precautions to avoid mosquito bites. This includes using EPA-registered repellents safe for pregnant women, wearing loose, long-sleeved clothing and pants, and staying indoors during peak mosquito hours, especially dusk and dawn. If you're traveling to an area with Zika risk, consult with your doctor before your trip to discuss additional precautions. Chikungunya virus. Chikungunya virus, transmitted by Aedes mosquitoes, causes flu-like symptoms and severe joint pain. The good news is that it's rarely fatal, but the joint pain can be debilitating and long-lasting. Symptoms: high fever, severe joint pain, especially in hands and feet, headache, muscle aches, rash, fatigue. Precautions: like other mosquito-borne diseases, prevention of chikungunya focuses on avoiding bites. Repellents, protective clothing, and mosquito breeding ground elimination are key. There's no specific treatment, but pain relievers and rest can help manage symptoms. West Nile virus. West Nile virus is transmitted by Culex mosquitoes. Most people infected with West Nile experience no symptoms or mild ones. However, a small percentage develop severe neurological illnesses. Symptoms: fever, headache, muscle aches, skin rash, vomiting, diarrhea in severe cases, encephalitis, inflammation of the brain, or meningitis, inflammation of the lining of the brain and spinal cord. Precautions: to prevent West Nile virus, Avoid mosquito bites by using repellent and wearing long sleeves and pants, especially during dusk and dawn. Well, remember folks, prevention is key when it comes to mosquito-borne diseases. By taking these precautions, you can enjoy a safe and healthy summer outdoors. Thanks for tuning in and stay safe out there.